show this message again ಅಂತೆಲ್ಲ ಮಾಡಿದೆ ಅದನ್ನು ಓಕೆ ಮಾಡಬೇಕಿಲ್ಲ
ರೆಸ್ಪಾಂಡ್ ಆಗ್ತಿಲ್ಲ ರೆಸ್ಪಾಂಡ್ ಆಗ್ತಿಲ್ಲ ಪವರ್ಪಾಯಿಂಟ್
ಹೋಗಲಿ ಆ ಫೈಲ್ನ ಕಾಪಿ ಪೇಸ್ಟ್ ಮಾಡಿಬಿಟ್ಟು ಡೈರೆಕ್ಟಾಗಿ ಇದ್ರಲ್ಲಿ ಓಪನ್ ಮಾಡಿ ಸರ್
ಇದು ಬರ್ತಾಯ್ತಾ
ಹಳೇದಾಯಿತು
ಹಳೇದು ಏನಾಗ್ತಾಯಿತ್ತು
ಕಾಪಿ ಪೇಸ್ಟ್ ಅಲ್ಲ ಸರ್ ಕಾಪಿ ಪೇಸ್ಟ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಇದಕ್ಕೆ
ಎಲ್ಲಿ ಮಾಡ್ಕೊತೀರಾ ಎಲ್ಲಿ ಮಾಡ್ಕೊತೀರಾ
ಡೆಸ್ಕ್ಟಾಪ್ ಮೇಲಕ್ಕೆ ಹಾಂ ಅಲ್ಲಿಂದ ಕಾಪಿ ಹಾಂ ಪೇಸ್ಟ್ ಮಾಡ್ಕೊಳ್ಳಿ ಸರ್ ಹಾಂ ಬೇಕಾದ್ರೆ ಪ್ರಿಂಟರ್ ತೆಗ್ದು
ರೆಸ್ಪಾಂಡ್
ಏನು ಸ್ಕ್ರೀನೇ ಬರ್ತಾ ಇರಲಿಲ್ಲ ಆಲ್ಟ್ ಕಂಟ್ರೋಲ್ ಡಿಲೀಟ್ ಹೋಗ್ತಾನೆ ಸರ್ task manager what is this today Microsoft PowerPoint ವೆಂಟಸ್ ಇವಾಗ ಡೆಸ್ಕ್ಟಾಪ್ ಇದು ಕ್ರಾಸ್ ಬರ್ತಾ ಇದೆಯಾ ಸರ್ ಹಾಂ
ಹ್ಞೂ. ಸರಿ ಕಾಣಿಸ್ತಾ ಇದೆಯಾ ನೋಡ್ರಿ ಅದು ಅಲ್ಲಿ ಹಿಂಗೆ ಬರ್ತಾ ಇದೆ ಈಗ ಸರಿ ಕಾಣಿಸ್ತಿದೆ ಇದ್ರಲ್ಲಿ ಸರಿ ಕಾಣಿಸ್ತಿದೆಯಾ ಇದನ್ನು ಮಾಡಿ.
Are you able to see on Good afternoon, dear students. So in today's practical class, so we are studying about congestion. Okay. So there are two terminologies you need to understand before we go to the congestion proper. So this comes under one of the hemodynamic disturbances. Okay. So there are two terminologies. One is hyperemia, the other one is congestion. So what is hyperemia and what is congestion? What happens in both of these processes? So in both the processes there is increased blood within the organs. The pathogenesis is different. So in hyperemia what happens is there is increase in the blood flow in the arteries and arterioles which supplies to the organs. So that is hyperemia and that is a active process. Congestion on the other hand is a passive process. So what does the venous system do? So venous system takes away the blood from the organs and drains it to the right side of the heart, right? And from the lungs to the left side of the heart. So what happens in congestion is there is obstruction to the venous outflow. Okay, so there is obstruction to the venous outflow. So even in this process there is stasis of blood within the organs. So this is called as congestion and this is a passive process in contrast to hyperemia which is a active process. So I have written it as CVC. So what do you mean by this CVC? So this is chronic venous congestion. So chronic venous congestion is nothing but the congestion what I described till now, and it is a passive process where there is obstruction to the venous outflow. Okay. So in your syllabus, in the practicals, you need to see. So we are going to show you 3 histopathological slides, okay, of chronic venous congestion of lung, chronic venous congestion of liver, and then chronic venous congestion of spleen. Okay, so these 3 slides we have. Okay, I will take up each one by one. Okay, so before we go to the histopathological and the pathology of the disease, each organs proper, I will just briefly tell you the pathogenesis behind this. Okay, so as I described earlier, so the chronic venous congestion of the lung. So if it has to be a chronic venous congestion of the lung, that is the stasis of the blood should happen within the lungs. So then when does this happen? So whenever there is left sided heart failure. So left sided heart failure, their causes can be many. It can be in myocardial infarctions, okay, anginas, and whenever there is obstruction to the mitral stenosis, aortic stenosis, and in all these cases, okay, so there is the venous outflow to the left side of the heart is deranged. So the pressure is transmitted upstream of the left heart, and in turn there will be pulmonary congestion. Okay, so the pulmonary veins will be congested, and in turn the patient develops chronic venous congestion of the lungs. So this is for the chronic venous congestion of the lung. So if you see the pathogenesis and how does the CVC liver or spleen, kidney and other things happen. Okay, so this is seen in right sided heart failure. In conditions of right sided heart failure, so again the pressure is transmitted upstream the right heart, then systemic venous congestion. Okay, so in turn, so systemic venous congestion in turn give rise to the chronic venous congestion of liver, spleen, kidney, and also you can see the leg veins which are congested. Okay, so now we'll see each one of them. Okay, so first one is chronic venous congestion of lung. So I already described you what is the pathogenesis of chronic venous congestion of lungs. Okay, so whenever there is obstruction to the venous outflow from the lungs, so that is pulmonary veins. So any cause which is giving rise to left-sided heart failure, any cause which is giving rise to left-sided heart failure will give rise to pulmonary congestion and in turn chronic venous congestion of the lungs. So what happens if there is chronic venous congestion of the lung? So imagine that whenever there is chronic venous congestion, I already told you that the venous outflow is obstructed. So the blood starts staying within the organs. Normally the lung contains air, right? So when the blood starts staying within the organs, what happens? Okay, so the lung will become heavy, right? So the lungs will become heavy and there can be the rupture of these smaller blood vessels, the RBCs come out, right, and hemosiderin pigment is generated. Okay, so grossly we call it as brown induration of lung. Okay, so grossly the lung will look like a brown induration. Okay, so because of these hemorrhages. So if you see the microscopy, which is very important, and this is the slide what we are going to show you. First identify that it is a lung tissue. See, can you see these spaces? These are the alveolar spaces and this is the septa. Okay, so normally the septa will not be so big. Okay, so this is the actual real picture of the CVC of the lung and this is the diagrammatic representation. This is what you have to write in your record books. Okay, so normally the septa will not be so thick. So here because of the obstruction to the venous outflow, so the veins will get engorged with the blood. Okay, so you can see these veins which are filled with RBCs, right? Veins and so the septa will become widened. That is the first thing. So you can see the widened septa and congested blood vessels. What happens after some time is these blood vessels or these veins and venules, they rupture, the RBCs come out. Okay, so they start filling even the alveolar spaces and once these RBCs come out, okay, so then they are lysed and hemosiderin pigment is generated. So that is taken up by the alveolar macrophages. So see, these are the alveolar macrophages which are seen within the lumen and also few in the septa. So these are called heart failure cells. See, heart failure cells can be asked as a 3 marks question also for you. So what are these heart failure cells? These heart failure cells are nothing but the alveolar macrophages which have engulfed the hemosiderin pigment. See, this is the histopathological picture of the lung tissue. You can see the ruptured septate places, widened and thickened septate places, okay, congested blood vessels and see these small round structures. Okay, so these are the alveolar macrophages which have engulfed the hemosiderin pigment. Hemosiderin pigment will appear as golden brown pigment within the macrophages. Okay, so these are the heart failure cells. This is the classical picture of CVC of lung tissue. What is this black see, this is the thickened alveolar septa, heart failure cells. These are the intraalveolar RBCs. So this black pigment is the carbon pigment which you normally see in anybody's lung tissue. Okay, so this is the histopathological picture of chronic venous congestion of lung. So you have to remember two things here. They can just ask you as brown induration of the lung. So that also happens in CVC lung and heart failure cells. So these are the classical cells, the macrophages which have engulfed the hemosiderin pigment, which are called as heart failure cells. Okay. So this is about chronic venous congestion of lung. So next we will move on to chronic venous congestion of liver. So we already saw the pathogenesis. So what is the cause for chronic venous congestion of liver? One is systemic venous congestion. Okay, so any cause which is giving rise to right-sided heart failure can give rise to, so back pressure, so that is through the inferior vena cava, and then that can give rise to chronic venous congestion of liver. And any cause which is giving rise to obstruction to the inferior vena cava, or any cause which is giving rise to obstruction to hepatic veins. Okay, so other than this right sided heart failure, so any cause which is giving rise to obstruction to the inferior vena cava and obstruction to the hepatic veins can also gives rise to chronic venous congestion of liver. Okay, so the blood will start staying within the liver. So then that we call it as chronic venous congestion of liver. So there is a classical gross appearance of chronic venous congestion of liver. So that is called nutmeg appearance. So what is this nutmeg? So nutmeg is, if you see the cut section, you take a nutmeg and cut it and see. Okay, so you will see alternatively light and dark areas, or the mottling appearance. Okay, so here it is shown as a mottling appearance. So the classical appearance is nutmeg appearance. So the cut section of the liver will show a nutmeg appearance, that is alternatively light and dark areas. So to understand this concept of alternative light and dark appearance, first we will understand the microscopy, then we will come back to the gross again. Okay, so what happens to the microscopy? So if you see the histopathology of chronic venous congestion of liver, so as you know there are 3 zones, right? So the centrilobular hepatocytes will show hemorrhagic necrosis. So as I told you, the veins will get engorged with blood. So here the central vein, which is in the center of the hepatic lobule. If you remember the histology of the liver, so the liver is divided into hexagonal shaped lobules, right, histopathologically. Hexagonal shaped lobules, in the center of that hexagonal shaped lobule will have a central vein. So here the central vein will be engorged with blood. So what happens? The hepatocytes surrounding the central vein will show hemorrhagic necrosis. So central vein surrounding the hepatocytes surrounding the central vein will show hemorrhagic necrosis. Okay, and then even the sinusoids will be filled with blood. Sinusoids will be filled with blood, and those, if you observe the hepatocytes towards the periphery of the lobule, see they are showing a fatty change. That's because of hypoxia. See, the periphery of the hepatocytes are showing a fatty change. Okay, so this is the classical appearance of chronic venous congestion of liver. I'll show you the picture here. See, this is the central vein. So this is a central vein which is being dilated and engorged with blood, and see the surrounding hepatocytes around the central vein which is showing hemorrhagic necrosis, and these are the hepatocytes towards the periphery. The fatty change is not very obvious in this picture. See here. So as you go towards the periphery of the lobule, they start showing fatty change, and sinusoids are also filled and engorged with blood. So this is the classical picture of microscopic picture of chronic venous congestion of liver. Okay, imagine there are so many hexagonal shaped lobules. Okay, so wherever the central veins come, that areas will show hemorrhagic necrosis. So wherever there is a peripheral fatty change area, so that will appear light. Okay, so if we go back to the gross appearance now, the cut section of the gross appearance, why there is alternate light and dark areas? The areas corresponding to hemorrhagic necrosis, appears darker or reddish. Okay, it may not appear completely red. Okay, so that appears darker, and the areas corresponding to hypoxia or the areas corresponding to the fatty change will appear light. Okay, so that's why you see the area of alternatively light and dark areas. So the light areas corresponds to the changes what we see as fatty change. The dark area corresponds to the changes what we see as a hemorrhagic necrosis. So that alternate light and dark areas what you see in gross is because of this histopathological change in the liver, and that is called as nutmeg appearance of the liver in chronic venous congestion of liver tissue. Okay, so this is about chronic venous congestion of liver. So in the practical records, we want you to write the histopathological picture of chronic venous congestion of the lung tissue, like how it is shown here, and then here, so the chronic venous congestion of liver. So the last slide of today is chronic venous congestion of spleen. Okay, so this is the last slide for today. That is, so I already explained you the pathogenesis. Okay, so again the cause for chronic venous congestion of the spleen is right sided heart failure. Okay, systemic venous congestion can also give rise to chronic venous congestion of the spleen. And any cause which is giving rise to portal hypertension, for example cirrhosis, so that can also give rise to chronic venous congestion of the spleen. Okay, so if you see the, so this is the spleen, where the spleen will be enlarged, okay, and the red pulp will be engorged with blood vessels, okay, blood vessels and blood. Okay, so now coming to the histopathological appearance of chronic venous congestion of the spleen. So first you should identify that it is, once the slide is given to you, first you should identify that it is a spleen. So if you see the histology of the spleen will have a capsule and trabeculae. Okay, so the same picture you can see in the lymph node. Okay, so where there are lymphoid follicles and sinuses. But how to differentiate that from the spleen is, so here you will see the trabeculae, which you will not see in a lymph node. And then here in the white pulp you can see lymphoid follicles with an efferent arteriole in the center. Okay, center or eccentrically. So within these lymphoid follicles, if you observe carefully, you can see the efferent arteriole, which you will not see in a lymph node structure. Okay, so first you identify that it is spleen slide. So by seeing the capsule, trabeculae and white pulp with lymphoid follicles in and an efferent arteriole. So what happens in chronic venous congestion of the spleen? So the sinusoids will be filled with blood. Okay, they are all engorged with blood. Okay, and again there will be rupture of these blood vessels or sinuses and spillage of the blood. Okay, the liberation of the hemosiderin pigment. Okay, and then there is formation of the Gamma-Gandhi bodies. So what are these Gamma-Gandhi bodies? So as this is a, as I told you, venous this congestion is a passive process and it is chronic in duration. So it will be there for long time. So during that duration there will be organization of these repeated hemorrhages. So this organized repeated hemorrhages along with calcium deposits. So these are also called as siderofibrotic nodules. Sometimes calcium may get deposited in this, sometimes even iron may get deposited in this. That's why this is also called as siderofibrotic nodules. So white pulp will be less, the red pulp will be more. Okay, so the red pulp will be enlarged, white pulp will be congested, or white pulp will become less, and there is engorged blood in the sinuses, and there is formation of Gamma-Gandhi bodies. So these Gamma-Gandhi bodies are nothing but siderofibrotic nodules. This happen because of organized repeated hemorrhages with the deposition of the calcium and iron salts will give rise to the formation of Gamma-Gandhi bodies. So this is how the Gamma-Gandhi bodies appear in a slide to you. Okay, so this is a Gamma-Gandhi bodies where organized hemorrhages and fibrous deposition along with that few calcium deposition will look like this. Okay, so the repeated hemorrhages and the yellow, the golden brown, that yellowish hemosiderin also you can see within this Gamma-Gandhi bodies. So this is classical of chronic venous congestion of spleen. Okay, so that is about chronic venous congestion of the spleen. Hope you understood all the 3 slides. So these 3 slides are very important. Okay, one is chronic venous congestion of the lung. There the most important thing is brown induration of the lung. What is the cause for the chronic venous congestion of the lung? And then microscopically you are going to see the classical heart failure cells. In chronic venous congestion of the liver, They can ask you nutmeg liver. So I just explained you what is nutmeg and how does that appearance happen and what is the histopathological changes in chronic venous congestion of liver, and I hope you also understood the causes for chronic venous congestion of liver. Then the last one is chronic venous congestion of the spleen, where I explained you how there will be formation of Gamma-Gandhi body and the histopathological and gross picture of chronic venous congestion of spleen. Okay. So that completes today's class. So if anybody has any doubts, you can please put it in the message. Please put your attendance in the chat box. If any doubts, that also you can put it in the chat box. So fast track students, your list is separately put in the WhatsApp group. Hope you understood today's class. If any doubts, you can put it in the chat box. Thank you dear students.